Hi Tavinder, welcome to Healing After Infant Loss YouTube channel. Thank you so much for coming on today and for sharing your story. If we start in 2011, that was when you got married. Had you been with your husband for a while before you got married? And was the topic of children always something that you'd kind of discussed early on?
Yeah, I knew my husband 2 years prior to that. I had always wanted children before I met Mark, so that was something that I thought about and had an idea of having in my future. And he also liked children as well, so that was something that we both discussed. And he was like, "Yeah, I want to have a child as well at some point." So we both were on the same page, and that was kind of what we were hoping to have at some point after we got married.
Yeah. And then I saw that in 2012, your husband had testicular cancer. Do you want to talk to me about that experience? And did that affect your fertility at that moment?
Yes, that was obviously a very difficult time.
Mm.
He discovered the cancer a year off into our marriage, so it was a bit of a shock. They obviously confirmed it was cancer. It didn't affect my fertility, and subsequently didn't affect his, but it was in our first
Okay.
year of marriage that it was a bit like, oh God, this is like something that you don't really want to be dealing with.
Yeah.
And then he had to have an operation to remove it, and then the cancer came back and it went to his lymph nodes, so he had to have chemotherapy. So it meant
Okay.
that there wasn't any chance of us thinking about children or, aspects of trying to get pregnant or anything like that. This was something that we just had to kind of focus on, which was, his health and prioritizing focusing on that end of things. And also we had bought a property, so we tried to do the house up. So there was a lot of things going on. It wasn't, there was no aspect of children at all in that frame of mind. So we were just like, let's do this and then let's see what happens afterwards.
So with testicular cancer, because I said about
Mm.
does that affect your fertility journey? Just obviously you had chemotherapy and maybe that played a part, but the cancer itself that doesn't play a part because I don't know anything about this.
So
I'm
it can
so
do.
my
It
questions
can
are yeah.
chemotherapy can affect your fertility. And
Okay.
with his, obviously the removal of the testicle, they had to check if he was able to still have, the sperm was, had sperm available in the latter end of it. And that confirmed that the test said it was all right. And it said that, removing one wasn't going to affect anything like that. So
Yeah.
that was what, what was the case, but they didn't, that wasn't what was affecting his fertility, luckily. But obviously it was just a horrible period of time to go through in the
Yeah.
first of your, first and second year of your marriage. You're kind of thinking, this is not really what I want to be experiencing. And it was obviously a shock. And yeah, it was a terrible time. I was quite angry as well because this is not what something I would like want to go through in in the kind of a first day years of marriage. You're kind of thinking, this is supposed to be a
Yeah.
honeymoon period of your time. That's what people call it, but I didn't have any experience of what that meant. This phase in your marriage. I was just facing him being unwell, so that was a priority of just focusing on doing the chemo side. He had 3 cycles of chemotherapy, so that's what he did. Yeah, 3 cycles at that time.
I think as well when you hear cancer, you kind of think that's the big scary word, isn't it? That people are kind of scared to say. So, imagine after you first getting married and then getting that diagnosis must have been very scary and very sort of it's a scary time for both of you. So I'm really sorry that you kind of you went through that.
It's a horrible. It is obviously the C word is what they refer to it as dreadful.
Yeah.
Obviously, I didn't know anything about it before then,
Yeah.
and unfortunately, I've become an expert in it. Something that I don't want to become an expert in. But I felt it was my responsibility to kind of read up about it, find out what chemo taking, how it was affecting him. And you get obviously sickness, fatigue, that kind of end of it. It's a very difficult thing to have to go through, and you see somebody prior to that decline in a way that is not pleasant to see. And it if it can affect your relationship as well, because you're not doing what everybody else is doing. You're kind of having to do this thing which nobody can relate to and understand in that period of your life as well, being young as well. So that
Mm.
that embedded in all of it as well. So it was, alienating and isolating as well, because I didn't know anybody who had cancer and what that meant as well. Luckily he got through it. So, we were lucky at that point in our life.
I think cancer is very similar to infant loss and infertility, in that it's one of those things that you don't expect it to happen to you, and then when it does, you don't really know anybody else who's also been through it. And I personally haven't been through cancer, but I imagine it's one of those things that can feel very isolating and very lonely and very scary and very, taboo to talk about. And, like, not everybody has cancer, so therefore, you can't just talk to random people or all your friends and family about it. So it can feel quite hard. And then unfortunately in 2014, you said you got diagnosed with triple negative cancer. Now, I had to Google that before we got on the call, so I had some idea of what some of these words are, because it's very complicated words. So do you want to explain to me about what triple negative cancer means and what that kind of experience was for you?
I got sick relatively quite soon after Mark finished his cancer. So I got ill about, I think it was about a month after, which was quite quick. So I didn't have the time to recuperate from him being sick to me being sick. It was like patient care and then care of a patient kind of thing. We swapped chairs quite fast. Triple negative breast cancer is a cancer that's related to, not hormone related. And it can be quite aggressive, which is why they refer it to that. So survival rates are, if you get over the first 2 years after you finished having cancer, you can do quite well. But 5 years later, then you're kind of perceived as being normal. But it's not hormone related. So with the hormone related cancers, you have to take like medicine afterwards. Tamoxifen, I think it's called. But with triple negative, they don't give you anything. It's kind of like off you go sort of thing. So I found the lump and I thought, this is not going to be cancer. This can't be, And I was lucky to have a young gentleman who actually sent me off to have the biopsy. And when I did find out it was cancer, at the time I was on my own. Now they don't do that. They usually let somebody come with you. But at the time I got diagnosed, I was on my own. I didn't have anybody with me. And I just thought somebody was playing a joke, because it felt like, this doesn't make sense. How can I have it? I wasn't a well person, was well fit. Not that it matters in terms of getting cancer, but obviously, there's higher risks of if you're doing other things like smoking and drinking, etc. I was a bit, shocked. I just didn't understand what was going on. And then I told Mark, and it was just like, surreal shock. Didn't know what to do. How do you handle this? It's just doesn't make any sense. And then, I had to go through, with my sense of things, they were conscientious that it would be best for me to have my fertility preserved due to the chemo that I was taking would possibly affect me going into early menopause.
Right.
So that's how my fertility journey started. I would have obviously never considered having fertility treatment prior to that. So that's how it began for me.
So you did egg retrieval and you made embryos. And then you said that out of the 8 that you got, 2 of them were successful and sort of turned into, I guess, like 5-day embryos, whatever it is. And they weren't implanted straight away. You had to wait 5 years because of the cancer before you could try fertility treatment. Was that just the kind of, you were going through the cancer treatment to try and get rid of the cancer, I presume, or slow it down, or
basically, it were. I mean, I had 6 cycles of chemotherapy, and then I had the operations. I had a mastectomy, and then I had radiotherapy. So that took about a year of my life. In terms of cancer, can take longer in terms of the treatment. And then I was lucky that for me, they said the cancer is no longer there, but they have to do surveillance, which is check you every year. And I was, given the instruction it was best not to try to get pregnant, just purely because of the risk of it coming back, which with any cancer, it can within, a couple of years. So I thought it was best not to do anything of that kind of, especially I was conscious of my body and recovering and not putting myself through any other aspect of pressure. After cancer treatment, you can have fatigue anyway, you can have side effects as well with post having cancer, and also the trauma of having cancer as well is quite difficult to manage. And then obviously I met some other people, because I was like, there has to be other people that have this disease. And I was lucky enough to come across other people that had it, that I could discuss it with. And then, I just kind of had to shelf the aspect of children, because it was something that I couldn't really think about. So it was put on the side. And then, yes, 5 years I had to wait. And then it was kind of being in limbo because COVID hit after that. And it was just, I was watching everybody else get pregnant and have a child. It was just people that got married, before me, after me, were just having children. And I was thinking, I felt like my life was stationary. It wasn't going anywhere. I felt, it's not very nice aspect, because, they don't understand what you're going through. Not a lot of people knew that I had cancer as well. But when you're married, there's a perception that, you're going to have a child, and just because you're a married couple. And obviously that wasn't going to be possible for us in that period of time. So we just kind of got on with things. And there was always a hope with the embryos being there that there would be an aspect of us having a child later on, down the line. But it just took 8 years for that to happen. It was just limbo for such a long time, which was really difficult to manage, because so much of your life goes. Luckily, we're both well and healthy, but you're hearing so many other people's life kind of move on in the aspect of being a parent, and you're not being a parent. So that was, difficult triggers to deal with, especially with myself, having people have a baby. I was just thinking, oh, is this ever going to happen for me at that time?
And did you feel like also within that sort of 5 to 8 year period, like, oh God, I'm wasting another year, or I've just wasted another year? And like, because I know that for myself as well, like I experienced infant loss, and then I waited 2 years to then try again and experienced infant loss again. But within that 2 years, I was like, oh, I've just wasted another year. Oh, I've just wasted another year. Like, I need to, get on with this. Did you also feel that sort of sense of like, oh, I'm wasting time, just not being able to kind of do the thing, if that makes sense?
I think it was more a sense of being in limbo, like you can't do anything, you haven't got control, you can't change anything. But there was always a sense of hope that somehow it would happen. And also, I was relatively conscious of my age, because then, I was in my 40s. So you're thinking, yes, there is that aspect of time's running out. I haven't got the time with me anymore. It's going. And obviously my own fertility was declining as well. But there was always a sense of hope that we both had, that somewhere down the line, I think it's a kind of a false perception that IVF will work. And we both kind of thought, oh, this will kind of happen for us maybe somewhere down the line. So that's what we were kind of waiting for, is to do the fertility treatment. And that's when, when we got the green light, we thought, oh, that's it, now it's our time to sort of become a parent.
So then in 2022, after COVID had sort of calmed down and things, you said that you had fibroids and a word I don't know how to say.
Adenomyosis.
Yeah. So did you know you had that when you started the IVF and they started doing scans and figured out that you had these things, and you didn't know beforehand? Is that correct?
I knew I had fibroids, but my fibroids got larger basically after I had cancer. My periods came back, so I was lucky that I wasn't put into menopause or anything like that. But I just ended up having fibroids, which are non-cancerous, horrible things that are in your womb, and I had a couple of them. And then when I had the scans to do fertility treatment, they told me that I had adenomyosis, if that is the correct way to pronounce it, which is basically mass in your womb that's not supposed to be there. It grows everywhere. It's sort of the sister of endometriosis. And I didn't know what that was as well, like you. I was thinking, what is this thing? What does that mean for me? And they said it was quite extensive, which would mean a
Right.
problem when, you put the eggs back in. So they suggested that I have the fibroids removed first. So I had a myomectomy, which is, removing that. So I got rid of the fibroids. And then with the adenomyosis, they suggested that I have hormone suppressant, which was to hopefully slow it down and not have it lessen in terms of not grow further. I mean, my womb was actually quite large at the time anyway, but I did what what doctors tell you to do. I kind of followed what their
Yeah.
advice was. I thought, let me give myself every opportunity to put myself ready so that this might work. And that was a suggestion that they gave to me. And then they said, the best thing was to put them both in. So from everything being in limbo, everything happened so quickly. It was just bizarre from one end of extreme to another, where all this is happening, and then people are talking about pregnancy, and you're thinking, my life has been not talking about children, and now you're suddenly talking about children. It was bizarre. And everybody else was talking about, me being a geriatric mother, which I thought was terrible. When you get into your 40s,
Yeah.
there's that kind of, you might be difficult for you when you get pregnant, and it's going to be difficult for you to give birth. And you're thinking, but this is where I am. I can't, I didn't choose to be here, but this is where I am.
Yeah.
And I have to do what's best for myself. There was one particular lady who was kind of saying to me, but you can do this at any point in your life. Why do you want to do it now? And I was thinking, well, that's got nothing to do with you. And it was just judged
Yeah.
on the decision I was making as to why I was doing it. But, that was when I was ready to do it. And they were there for me to use. And I wanted to utilize the chance that I had, which is what I did. And that was what I took. But everything was so fast, and they talked about me having twins. They said, we're going to put both embryos in, because then there would be a chance for you to either have one hopefully work or have twins. And I was thinking, my God, twins. I was thinking, I'm not prepared for this, suddenly having nothing to having twins. It was just, everybody was talking at me, and I felt, there's such a lack of control, especially with cancer, but also with this as well. And I had to bring Mark in when they brought the embryos in, because I just could not make a decision. And that was my first time when I just thought, I don't know what to do. And I said, what do you think? Because I just couldn't. I was all over the place mentally. And fertility treatment, anybody's been through it, is such a difficult, rigorous thing to go through. I mean, I've had cancer, but that's just as difficult in terms of the medication they give you, the scans, the time that you're going to from doctors. It's just such a stressful time. Whereas you perceive that, trying to get pregnant is such a beautiful period of time. But I didn't feel like that. I felt this is just so stressful and so difficult to deal with.
I think that's one of the things with like infertility, is that there is that dream on TV and films, and people talk about oh, you get married and then you have the honeymoon phase, which you said you didn't really get to experience, and then you get pregnant, and oh my God, 9 months later you have a baby and it's the most beautiful thing. 2 years later you have another baby, and like it's it's always shown as this like magical, glorious thing that everyone should experience, will experience, but it's not really spoken about enough that doesn't happen a lot of the time for a lot of people. And I think also the kind of disappointment and the anger and the like, there's a lot of emotions that go into that when you don't get the thing that you want, or the way that you plan things to go. It can be really frustrating. And I think, like you said about the geriatric pregnancy, I think there's also a lot of stigmatizing words and like not enough care taken for people throughout this period of life. It's there's a lot that happens, I think, for people like us who kind of go through this experience.
Yes, I completely agree. It's a difficult thing, and you don't know anybody else who is having all of this at the time, because everybody else, like you say, is just getting pregnant and having a child, and you're not. And then there's that sense of like, people asking you, do you not have a children? That kind of question, or do you not want to have children? And it's not that I didn't want to, I just didn't have the choice to have it because I was having cancer. And I think that's
Yeah.
where the issue is. People can be very sensitive about asking intrusive questions, not understanding what somebody's going through, because sometimes you don't look as if you're having treatment, or or whatever somebody's going through is their personal journey. I think there shouldn't be that kind of opposing question as to why somebody is having a child or not. That's their personal decision. And then, when you're married, there's that double pressure of expectation that because you're married, you should be having a baby. What's wrong with you? Why are you not having a child?
Yeah.
That's also there as well. So that, that's all entwined in it all as well. I mean, I knew certain people who had got, when they did cancer, they were put into menopause, and that takes that away. So cancer can take it away from you. So it's not, people think, oh, it's this or that, but there's so many things involved in why somebody can't have a child. And that's their personal journey. And there needs to be a lot of understanding around that.
It's one of those things as well, when people ask, like when people ask me, do you have children? I say no. Like, oh, didn't you want children? And I kind of feel a sense of like, well, I've either got to tell you the truth about my infant losses, or just sort of brush it off and be like, oh no, not maybe later, or not, didn't really work for us, or like, yes, I had pregnancies, but but then I can imagine also with the cancer on top of that, of being like, well, we wanted to, but we had cancer, we had to deal with that first. And then it's kind of an added layer of someone's story. And I guess, it can happen with so many people for so many different reasons. Like cancer is one of them. I think finance is another one, career is another one, not finding the right person, childhood trauma. Like there's so many different reasons why people either don't have children or put off having children, for later in life. So everybody, I just cut off them, but we're back. So I was talking about when people ask us about infant loss and then what we say in return. And I was going to ask you, Tavinder, what do you say when people ask if you have children? Do you go into the details, or do you just say yes or no, or what do you say when people ask?
It depends what the situation is. Usually I just say no, and then that's it. Or I just say, I'm childless, not by choice. And that's another thing I say. It depends who it is and within the situation that I've been in.
Yeah.
And if they keep pushing and pushing, which I had one particular issue with a particular person who just kept on asking me, then I had to tell her, this is blah blah blah, go into things. But usually I don't think it's to anybody's business.
No.
I don't understand why they ask the question anyway, because I don't usually ask other people, are you married, do you have a child? So I don't know why other people see the need to do that. So it depends on the situation that I'm in.
I think people that have children are very happy to talk about the children that they have. So I think rather than asking people, do you have children, just wait for them to say, oh, by the way, my child did XYZ today, and then you'll know that they have children or not. But I think that question is not welcome a lot of the time for people that have been through infant loss, because it's just kind of unnecessary.
I completely agree. It is unnecessary.
Yeah. So if we go back to your story, so in 2022, you implanted both embryos. Is that normal? Because I don't know why, but I thought in the UK they wouldn't implant two at the same time. I thought they would have to do one by one. Is that, or is it a special case because of what you've been through and things like that?
I think that was the advice that I was given for myself in my case, that it would be better to put two in due to maybe having the possibility that one would implant.
Right.
And I was over 40 as well at the time. So maybe they were taking my age into consideration as well, and also the finance side of it. We were self-funding as well. They don't always fund you when you are a particular age. So all of that comes into it as well. So it was their advice that I followed. I thought, okay, let's just put both in because that's what they're telling me to do. I didn't question it. So that's what I did. I followed their advice.
And then what was your experience with that? Because you said that it didn't work and it was unsuccessful. Did you have any pregnancy symptoms, or did you ever feel pregnant? Did you get a positive pregnancy test or none of that? And you went for the scan and it was what? Do you want to talk to me about that experience? What happened?
Sure. I had a sort of a 2-week period of waiting time. So I thought, do you have to lie down? Do you have to put your feet up in the air? What do you do? How do you sort of? But I was told by a lot of people that you just get on as normal. That's what that's what the people told me, the fertility side of things.
Mm.
So I just got on with things. I didn't think about it. And then they just said you just do a pregnancy test to
Right.
find out if you are pregnant or not after that period of time. And when I did the pregnancy test, and obviously wasn't, um, obviously I wasn't pregnant. I think I just went into just complete shock and devastation. It was something that I I just couldn't believe,
Mm.
that it didn't work. I felt such pain, grief, so many emotions inside me, that I felt like a sense of injustice as well. Somehow I felt like I was due something with having cancer. Not that life works that way. But I thought, oh, hang on a minute, the universe has done this as well, whatever out
Mm.
there has done that, as well as having cancer. I just couldn't, I was blaming whatever I could blame at the time to kind of cope with what the outcome had been for both of us. And I think, Mark just didn't know what to do, how to help my wife with, the pain that I was going through was something that I think you can't explain to anybody. And everybody's pain is individual, and everybody's grief is, you know, their own individual journey. But it was
Mm.
just the devastation that I felt like. I felt like my life was over. I just felt like I don't know, what else I'm going to do, because it was such a lot, such a hope in our life that we had this kind of, notion that we were going to have a child in our future, and it just ended. And
Yeah.
then you think, what do you do now? There isn't a book about it or anything. Not that anybody can give it to you, but yeah, just into shock, and anger, and yeah, so many things in my head at that time.
I think with IVF as well, there's that kind of expectation that it's going to work. And you kind of
Yeah,
think, right, we're doing this science thing. Like we've got embryos for a start, because of, having sex and getting pregnant and all the rest of it. So we've got embryos, we're going to implant two, so there's double the chance it's going to work. And I think there's that kind of misconception that, when people experience miscarriages or infertility, oh, just do IVF and then you'll get pregnant. Well, actually, through speaking to lots of different people, IVF, does work for some people, doesn't work for other people. And I think it's kind of important to put that information out there, because I think, maybe I'm wrong in saying this, but I think a lot of people pin a lot of their hope on IVF and think, oh, well, I'll wait a bit longer, I'll do it a bit later, I'll just do IVF, it'll be fine. But actually, I think it's important to know that IVF doesn't always work. And obviously, I'm so sorry you experienced that. It's awful. And it's, like you said, it's a pain that you can't describe to anybody, because if that was, was that your only hope then? You couldn't get more eggs because of the cancer
I
and
was too
things?
old. By that time, they
Oh,
don't want to
okay.
consider you doing anything more, because I was over 40. So in the 40s, there isn't any, they don't want to consider you doing anything else at that time.
Yeah.
And yeah, you're right with all the things that you've said. There is that sense of IVF kind of is portrayed as being
Yeah.
working in the media. Somebody
Yeah.
always has some IVF miracle baby. It's so much in social media, it's on the TV. Nobody shows it as it not working. So there is that misconception that you kind of have that it works, as well. And there's not enough people that come out and talk about it not working as well.
Yeah.
So yeah, you're right. I think there is a misbelief that this thing is going to somehow happen. Um, Not that I didn't have that notion. I was thinking, oh, okay, let's just give it a go. But yes, when it doesn't work, I think there's no sense of being prepared for that. They don't prepare. They don't help you. They don't say, oh, here's a counselor. You don't know how to manage it. I think they kind of leave you to kind of deal with it on your own, which is also an issue with it as well. With, you have to look into getting therapy yourself after it not working. So there isn't any help given to somebody. It kind of shafted off, okay, go over there, it didn't work
Mhm.
out. So there was no option for me after that. It was like, that's it, we've done what we've done, we've kept it now, that's it for you. So that
Yeah.
was the end of our journey.
You said that you didn't have enough time to grieve. Do you want to talk to me about your grieving process and how that was for you?
Yeah, unfortunately for me, what happened was that my womb just got worse after I had IVF treatment. So maybe it was the hormones and things that I was taking, because that's another thing that people say, oh, you take these hormones, produce estrogen into your system. Obviously for me, I had to get that confirmed that I could do that as well with having a prior history of cancer. So all of these things taken into consideration under the medical side. But my womb just got worse. I ended up having severe bleeding, and then I found out that my fibroids had come back and were larger than they were originally. And I just suffered with pain and excruciating pain to the point where I was screaming every time I had a period. I just couldn't manage. And then it was the adenomyosis obviously was happily, with the suppressive hormones that I wasn't given, that was also going back. So there was double the issue that I had with my womb, and I looked like I was pregnant basically, which wasn't helpful either. So when I would go out, people were just assuming that I was pregnant because of how large my womb got. It was, the kind of thing they compare it to isn't helpful. They kind of said, oh, I was looking like I was a 42-week-old pregnant woman. But I was thinking, I don't know what that means, Um, the way I looked, I thought, okay, is that how you look? But yeah, I had to basically have a hysterectomy because of all of that. It was just that I was suffering, and I couldn't manage my life with the uterus that I had. So I just didn't have time to think about what it meant. Obviously, I had grief there, but it was just that I had the issue of, okay, now I've got to deal with my womb, because my womb's taking over my life. It just wasn't working. It was just saying, get rid of me. So I had to basically listen to it and remove it. And that's what I had to make that decision, which was best for myself doing, which was having that operation.
So, with the hysterectomy, I mean, obviously, you went to the doctors and talked about your pain and things like this. Was it you that said, I would like a hysterectomy, or was it the doctors that said, we should do a hysterectomy and remove the womb? Or was it
Yeah,
together, I
it
guess?
takes a while to get a gynecologist referral. Let me say that as well,
Yeah.
because women suffer from these issues. It took over a year for me to see a gynecologist. I was suffering like that for about a year. Let me put that in perspective. So, with the bleeding, several times, I just didn't have much of a life in between that period. And then the gynecologists, after they did the checks, they were the ones that said, look, we feel that you have to have your womb removed because of the status it was in. And the extent of the bleeding that I was having wasn't good for me as well in terms of my health. And that was what they suggested. And also I wanted to get rid of it as well on top of
Yeah.
that, because I just wasn't having a life of my own at that point. I just couldn't function with the pain and the bleeding that I was having. I was just having no quality of life whatsoever for myself. So yeah, that was what I was. Luckily, I was given the option of doing that, and I took it for that reason.
This might be an odd question to ask, but I'm just kind of thinking, like, I think, like you said, a lot of women suffer with things like this and they're not believed, they're not trusted, they're just kind of brushed to the side, just wait a year, whatever. Do you feel like if you had that excessive amount of bleeding coming from your arm or from your forehead or something, you'd have been taken more seriously? Because I think a lot of women's issues, because it's there, it's kind of like, oh, it's just a heavy period, oh, it's just normal, or just be fat. I think it's minimized a lot. Whereas I think if men experience this amount of pain, or if the blood was coming from any other part of your body, you'd be in, A&E being like, okay, we need to sort this shit out. Not like, wait a year, we'll sort, do you feel like that's kind of the case?
Definitely. I mean, there is definitely misogyny in the medical
Yeah.
practice. I mean, I've watched, Naga Menchetti talk about her adenomyosis and also read her book. She suffered with it, and thankfully she spoke about it vocally, how you're basically, as a woman, you're kind of told to suffer. That is
Yeah.
it, or take some drugs, take paracetamol. That's what I was told. Take painkillers.
Yeah.
Take trisamic acid, which is basically blood clotting medication. Take that.
Right.
And just kind of get on with it. That's what I was told. There was no kind of other option, when you're kind of dealing with that. And as a woman, you do unfortunately get on with it. Obviously, I went to the doctors several times and I had to get the medication, but that's all they give you, medication, and then you have to wait to see a gynecologist. But in the middle time, yes, you are basically suffering. You're correct.
Yeah.
With extensive bleeding. Some women end up going to hospital, having to have blood transfusions. You're right. If there was anybody else having to deal with this, i.e. a man, they would be taken straight away, to be dealt with. But as a woman, you're just kind of, oh, well, you're not a woman. That's your job, is to suffer.
Yeah.
And that no one should suffer in that sense of things. And there's so many other women who've had these cases where they have just been ignored relentlessly by doctors. I mean, to wait a year to see a gynecologist is ridiculous in itself.
Yeah.
And then on top of that, I had to wait quite a considerable time to have the operation as well. So that didn't happen quickly either. And they just seem to delay things as well, for whatever reason. I don't know. Pressures, obviously, I understand. But women in the meantime are just having to bear it, and that's not a life that you can live. It's
No.
not. There's no. When the way I was suffering, I don't know how I went to work, and I don't know how I managed at that time.
Mm.
But you kind of just do, and I think that's wrong as a woman, to have to go through all of that.
Yeah. And then the hysterectomy operation. I don't really know what my question is, but that seems like quite a big operation. What was the kind of recovery time like? What was the operation like? I mean, obviously you must have been put under. Do you want to talk to me about kind of your healing journey afterwards? Did you get pain meds, and
Oh.
were you looked after, and did you have time off work and all those kind of things?
Yeah, I was given the option of having keyhole surgery, which is less invasive
Okay.
surgery. And then they, obviously this was my third surgery, in a lifetime. So there's not such, again, going to hospital is terrifying as it is.
Yeah.
And I spoke to somebody else who had had a hysterectomy, because I was like, what is this, what is this going to tell? How long is the recovery?
Mm.
She gave me a lot of information about it, and I went on to other groups and other women that had it. And it's luckily for me, it's a short period of recovery. Those recoveries quite quick, you kind of bounce back. But obviously, operation like any other is a difficult thing to go through. My operation, they took it longer just because they weren't sure about the bladder side, and they had to I was in there a lot longer as well, because they weren't sure as to whether they could do keyhole surgery or not with
Mm.
me,
Okay.
specifically because of how large my wound was.
Okay.
Well, they managed to do it, but it's not always the case with other people, depending on that side of things. I've recovered fairly quickly, but it takes time. You have to take off several weeks after going back to work, and take time out for your sense of recovery. Obviously, my wound was still large after that as well, but I felt like it was more the difficulty of going into gynecology rooms, which I don't feel that individuals are sensitive over, where you're surrounded by women that are pregnant, and
Yeah.
you're going in there for a totally different reason, and that is often not thought about by the medical practice. That kind of, I'm getting rid of my room, or have gotten rid of my room, and there's other people around pregnant. There's no sensitivity. And there was also the first doctor that came to see me after I had hysterectomy, if you can believe it, was pregnant. I mean, that is just I mean, I don't know where somebody's thought process comes into that. I mean,
Yeah.
they don't read somebody's notes. There's no sense of consideration when it comes to women, I think, as a whole, when you're, especially, all the ultrasounds, everything you're having to do are all in the same line as somebody's pregnant, and you're not getting, you're not having a child, and that is so traumatic and
Yeah.
upsetting to have to deal with.
Yeah.
When you're having to process the fact that you're not doing this as well on top of that, I don't think that the whole her medical side of things need to change,
Yeah.
to be more sensitive
I
around aspects for women.
I 100% agree, because I've had miscarriages, and then I go in for the scan and I'm surrounded by pregnant women knowing full well I'm having a miscarriage, and it's just like, what the fuck is going on? Like, why can't I sit in a different room on my own? Or yeah, there's so many different aspects of infant loss, infertility, all these different things that like isn't considered enough, and isn't kind of, it's not where it should be. There's so much that still needs to be done.
I agree. I also questioned it several times to them, like, why isn't there a separate place that you can go to? I was asking them, can you sort of hide me from not seeing women go in
Mm.
there that were pregnant? But it's just dreadful that they don't take any consideration into that. And I don't know why. There's so many people that have lost a baby or IVF for whatever reason, and yet they put you into the same place, and that psychologically that's so damaging for somebody.
Yeah.
Um, so it needs to be changed.
Yeah. So with the hysterectomy, that also closed the chapter, I guess, of having your own children. Was that equally hard as the kind of physical surgery? Was that also hard in terms of, you know, finally realizing and closing the chapter of like, okay, I'm not going to have my own children? Do you want to talk to me about that kind of process?
Sure. I think for me personally, I felt, it might sound weird, but I felt relieved that I had a
Mm,
hysterectomy, because I
right.
felt like even with my womb, the state that it was, I felt like I had still a false sense that I would somehow miraculously get pregnant. Oh, I'm going to get pregnant
Mm,
somehow. It's going to happen. Even, obviously you can still get pregnant in your late 40s, but I was just in that false hope that I was going to get pregnant somehow. And when you're in that state, it's like an illusion in a sense of things, especially with my womb, the state it was in, I wasn't going to be able to do that. And I felt a sense of like closure, that I don't have to think about this anymore now. I don't have to have the weight on my shoulders about getting pregnant anymore, because my womb has now gone. So that obviously I felt, grief of my womb going as well, because that's a loss of your body. It's an important part of any woman is a womb, and that also was causing me grief in my sense of my body and myself losing that instrument that can create, supposedly supposed to create life.
mm,
That in itself is a difficult thing to have to cope with as well. But I just felt like, now I don't have to think about it anymore. I don't have to think of myself having a child in that way, because it's not going to happen anymore, and I don't have to put any pressure on myself with any of this. So it was a bit of relief for me. And then it was grief again on top of that, with having your womb removed and then having to process again of what, top of everything else I had the IVF hitting me still, and then the hysterectomy side hitting me, of doubling that side of grief, of myself. And again, looking still pregnant, even though I didn't have a womb, because I was still big. I had to recover from that.
mm,
It's not pleasant and you're obviously, I was in my late 40s, and that kind of again is, you know, you're in a different point in your life.
yeah.
And that is another thing to have to get your head around, is, oh, I'm no longer, in the same frame of mind, in the same body, I'm at a different point of a stage in my life. This is now not going to happen anymore. So yeah, it was a chapter closing in my life. Um, and I think for me, it just was a sense of relief, but also pain of what I had also gone through hitting me as well at the same time.
Mm. I spoke to somebody else recently as well, and she'd um, experienced infant loss, and she tried surrogacy and adoption, all these different things. But I think when she decided that she was not going to do IVF again, it was that kind of sense of relief of like, okay, well, now the pressure is off me to kind of track my periods, or to figure out IVF options, or think about finances of this thing. And like, it's interesting to hear that that's the perspective from two people now is that actually it's a relief that I know that my body is not going to be doing that, versus, yeah, it's just kind of interesting that I've heard that twice recently, and it's just an interesting perspective, because I don't think, from outsider, I would think maybe it wouldn't be a relief, but it's interesting that it actually is for, for both of you. So thank you for sharing that.
That's all right, yeah.
So we're now in 2025. You've talked about in the email about fostering and adoption, and you're kind of somewhere thinking about that. Have you made any progress with thinking about that, or is it something maybe sometime in the future we consider? Like, where are you at with all of that?
Yeah, I mean, it's something in the future, because I think for me, grief is something that, is never ending. It's always there. Especially with IVF as well, there is no thing that you can grieve over. There's no tangible object. And I think that's where the difficulty lies in grieving, because I didn't know what I was crying about. What was I upset about? What is it? I was more concerned about other people, for example, like yourself or other people. I would be mindful that, oh, that's terrible for you, but I just didn't know what I was upset about. So I did think about obviously fostering and adoption even when I was doing IVF as well, and I looked into it and got all the information. But then after the IVF didn't work, I think for me the devastation was just too severe for me even to consider anything after that, because I was just like, I can't even, I've lost so much of myself. I didn't know what I was doing in my life. I felt, even with my womb as well, on top of all of that, it's just something you can't, people think it was a solution. I've had so many people say, oh, IVF, do I have IVF? Okay, done that. And now here's, why don't you do fostering or adoption?
Yeah.
If that's a kind of answer. And it's not an answer. I think people don't understand the pain you're going through, and what that means for you is not such a simple answer, and you don't even know if that's what you want to do. I think it's individual to everybody to decide what's best for them. And then some people said, oh, you can still do this or still do that, whatever. But I was just going through my own processes of feeling what I was feeling and trying to understand what that meant for me in terms of my life. And also, I think it's important to say of how much identity you lose as well as a woman, especially with that end of things, because you don't understand how you're supposed to live your life, because there's so much around having a baby, especially when you're young. There's not enough around what do you do when you don't have a child. I think that's another thing that needs to be there. And usually, when men meet men, they don't usually ask each other around children, because I always ask Mark, do you get asked that question? And he doesn't. And I think that's also another thing. Why do women, that's their purpose in life, is to have a baby. But if that's not what's going to happen for every woman, then what do you do if you don't have a child? That's also another thing. Because, as I said, that's that quick fix of adoption and or fostering, but that's not a fix to the solution. Not that there is a solution, and I think that's also a problem with how it's taken with things. And I've just spent so much time on grieving, I think, for me, and trying to understand how to grieve and what I was grieving over, because I didn't have a tangible object to grieve over as well. So it was that I was trying to get my head around. And also it's very differentiated in society, because people are like, oh, it's IVF, why are you upset about, they're just things, what you get into. There's that kind of dismissive attitude, because I didn't get pregnant or didn't have a baby. But for me, that is what they represented,
I mean, if
children's.
you implanted two embryos,
Yeah.
Had that been successful, they would have been children. So you did experience infant loss in my eyes, because, that was, the plan. You were hoping to have children. So in my eyes, you're grieving the loss of your children, you're grieving the loss of being a mother, you're grieving maybe an identity that you've put on yourself of like, I'm going to be a mother, and therefore, you're grieving the future of all the things that you're missing out on. Like, I speak to a lot of women about this, and I think with infant loss, it's not just the cells in your body or the pregnancy, it's also the loss of, Christmases and birthdays and taking the kid to school and their wedding and grandchildren. It's like, it's a whole thing. And it's, like you say, it's kind of minimized, and it's a disenfranchised grief. And that because you didn't have, a 6-year-old child that then died and everybody can go to the funeral and acknowledge that loss, it's almost as if it's invisible and like it didn't happen. And it can feel, especially because you're the one experiencing it, it can feel to everybody on the outside, oh, well, it wasn't that big, it wasn't a big thing. Well, actually for you, it's huge. It's a huge thing to go through, and it's a huge thing to grieve and to lose. So I understand not having the tangible thing, but also I think, acknowledging that actually it's a big thing that you did lose, and I'm really sorry that you went through that.
Thank you. I think some people with IVF might feel like the same way as I did as well. I think a lot of times when you meet other people, they also minimize it as well, because it's like, oh, it's IVF. There's that kind of, oh, you can do that. Well, well, you could do, there's that kind of, they also dismiss it, and they don't understand what you just correctly said. It's the same thing. It's not, whether you've had a pregnancy, whether you've had a baby, physical baby, whatever, they're all interlinked. It's still grief, it's still pain, it's still loss. And I think that's where, and also, I didn't know, because then, I had to read books, I had to find out a way to grieve, because I didn't know what I was supposed to be doing. What was I getting so upset about? I think grief is such a complicated emotion. I think, I've always felt like it's the worst emotion to go through, because it's so much triggered in, seeing people pregnant. It's triggered by, people talking about pregnancies. It's triggered by, seeing children. I mean, I got triggered by seeing twins. That's what I was triggered by, because that's what I perceived to be in my head that I was going to have. So that was what I got triggered by. So it's just, everybody's individual, and it's just so complicated. It's not like it's linear. There's no like, okay, you're going to get over it in a year or 10 years or whatever. It's just all the time when you get up and somebody asks you, are you, do you have a child? You think, oh my God, now here I go again. You're reminded constantly that you don't have a child. I think for me and Mark, it's just about working out about what do we do now? What is the next steps, and what do we want to consider, and leaving the options open, and not kind of thinking, oh, that is what we're going to be doing. Because I think, life is also about enjoying yourself, not just about having a child. I think there's a kind of, oh, this is the bees or ends of life. And it isn't. I think that's an also perception where girls should be taught from a young age that there is a life that is to lived without a child, that isn't just about having, because I see it so much with people on their social media. They put mother as their thing, and I think, why is that? Why is a woman just always a mother? Why isn't just a woman just a woman for her own means? So I find that is an issue.
Yeah, I completely agree with everything you're saying. Like the triggers thing, I get triggered all the time by, especially supermarkets is my thing, like the baby aisle. I still don't go down the baby aisle. But also, like you said, I think having gone through infant loss, and I'm kind of in that grey area as well, where like I'm not trying to have children anytime soon. I've also not said never. So I'm kind of in that grey area of like, I don't really know where I'm at and what's going to happen. Where was I going with that? I've completely lost my train of thought. Oh my God, I've just completely lost my train of thought.
It's just so difficult. I mean, the thing is, also as a couple as well, there's an issue that, I was at a different grief than Mark was. There's also that as well, because, you're not grieving the same thing. You're grieving it differently. You're reacting to it differently. I blamed myself as well a lot. I was, I'm the one that's called, it's my womb. I wasn't able to have a child. I've taken it away from him. There's all that kind of coming into it as well, especially with the men, being in a relationship with somebody, and then he's been more in that sense of fostering and adoption before me, and I was like, what are you talking about? I'm not even there yet. I don't know why are you considering this. It's everybody goes through it differently, and I think
Yeah.
that's the navigation side of it, that you assume that as a couple, as with our cancer as well, it was the same. We both went through it differently. Just
Mm.
because you're doing something the same, it doesn't mean you're going to process it differently.
Yeah.
So yes, it's an option. Like you said, you have to consider options, but it's not like, oh, this is what we're going to do, because you don't know what life is going to throw at you, which I've learned.
Yeah.
But I don't want to put everything into one thing, because it's not. I feel there's so much more out of life than just, all right, having, a family, and family can just be you and your husband, or you and your partner, or you and your parents. It doesn't have to be representative of having a child. I think that's the other thing that needs to be changed.
Yeah. I remember the thing I was going to say, in that because we're not trying for children, but we're also not said never, we've been traveling this past couple of years. We've traveled the world. And I think it's kind of given me a new sense, because I think when I was younger, I kind of thought, I'm going to be a mum. My life's purpose is to be a mum. I'm going to be a stay-at-home mum. I'm going to be a mum. I'm going to be a mum. I'm going to be a mum. That
Yeah.
was, I didn't focus on career or learning or any, I was going to be a mum. And then because I'm not a mum, I'm like, oh, okay, well, what else can I do? I can travel, I can learn things, I can do all these different experiences and different things. And I think, going back to your point earlier, women are expected to be a mum, and
Yeah.
it's kind of, your worth is based on whether you have children, how many children you have, are you a good mother? And, and it shouldn't be at all. Your worth should be on so many different things. It's like, you as a person, are you kind? Are you generous? Are you caring? Are you funny? Are you intelligent? Are you all these different things? And do you have experiences, and do you have love in your life, and are you happy? And I think, a lot of people put their worth on being a mother. Good for them, that's wonderful. But also for me, I'm like, I'm also a pretty good person, even though I don't have children. I'm a good person, and I've had a lot of incredible experiences these past couple of years, which I wouldn't have had if I had had children, which is also interesting to kind of reflect back on, that, your life can take a completely different path. And I'm not to say it's better or worse, it's just different. But yeah, I think, younger women knowing that you don't have to have children, it's not the be all and end all, and you can be happy, have a full, loving life without children, and your family can be you and your partner, or you and your cats, or you and your best friend, or family is whatever you make it, I think.
I think it's also the narrative that we have in society, which I've noticed, where a lot of women will say, as a mother,
Yeah.
only as a mother you can know, what the emotions are, only as a mother. And I think that's the problem. It's
Mm.
like this definitive sense that only as a parent you can know these things. And I think that's where the problem as well is lying in. Mothers of a rare, which is not a bad thing to do. Of course, people have a difficult thing to have to undergo, but people that do not have a child also have a difficult thing to undergo.
Yeah.
There's no, I've had people say to me, oh, my life must be so easy because I don't have a child. It is
Mm.
not easy in any way.
No.
Every day I wake up and think, oh my God, I don't have a child. I wanted to have a child. This is not where I wanted to be. And I think there is that lack of, there's that pedestal of women that have a baby.
Yeah.
And then, we're kind of the others, othered,
Yeah.
alienated, you don't belong in society, you're kind of shafted over there. I think that's the problem with all of this. There's so much narratives that need to be changed. I just get so annoyed and angered
One,
by this.
yeah. One of them that annoys me is when women say, "Oh my God, I didn't know what true love was until I had a
Yes,
child. I
yes,
didn't know what true happiness was
thank you.
until I had a child." And I'm like, well, that makes me feel like I don't know what true
Yeah,
happiness is or what true love is, because I
yeah.
don't have children. So, what, am I never going to experience this true happiness and true love and true whatever that these women experience? And I know they're just gushing over their children, and
Mm.
good for you, but they don't see it from the other side, and how that can make us feel like, oh my God, well, I'm never going to experience
Yeah.
that. And what am I missing out on? And, that's shit, that you're having this most, oh my God, it's just the love like nothing else. They're gushing over it. Amazing, good for you. But also that makes the rest of us feel like shit, because we're never going to experience that amazing thing that you're talking about. But then also, we can experience love and happiness, and the most incredible love in the world. And maybe it's for our dog or for our, husband or whatever it is, versus a child. But that's also one that also gets me, when people talk about how, oh, there's no love like it. And I'm like, well, fuck
Yes,
you.
thank you. I agree. There's so much of that. And then there's also the other thing about, when people have a baby, in offices and everybody goes gushing over and,
Yeah,
let's congratulate that person and gets everybody to sign a card. And there's no sensitivity around, hang on a minute, there could be somebody that has lost a child in the
yeah,
room. There could be somebody that's had a miscarriage or somebody that can't have a baby. There just isn't that
yeah,
sensitivity at all. You feel like you're invisible in the world.
yeah,
There was a work issue that I had where I said, look, I'm not going to go to somebody's baby thing, because I said, look, I don't have a child. And that was the first time I spoke about it. And I felt like, this needs to be in every place that we're in, that
yeah,
there needs to be mindfulness around this area, that you know not everybody can do this or wants to do it. That's their own decision, but there is has to be sensitivity around other people that might have gone through it as well, that there's a lack of understanding in so many ways that I didn't realize until I came a part of this place that that exists, that you're kind of alienated everywhere you go in society. When you're with other women, they talk about children. When you go out, you see people with children, you're thinking, where can I go?
yeah,
I still don't know. After 3 years later, I'm still trying to understand, where do I belong in the world? Where do I fit in? Where can I go? I still can't find that place of belonging. I think that's terrible. And I wonder if I ever will find that place of
yeah.
being in tune with others and feel like I can be not othered as somebody who hasn't been able to have a choice around any of these things that have happened.
I think the hard thing as well around this topic is that unless you go through it, you have no idea what
Hmm.
the others, us, what we're going through and what we're experiencing. So it's kind of one of them where, like, unless you actively go and find YouTube channels like mine or um, podcasts or read books about this, you're not going to understand it. And most people don't read or look into this unless they go through it. And then, therefore, they're in our group of being othered and being triggered by all these different things. So it's such a hard place because the people that are so oblivious are never going to learn or seek this information unless it happens to them. And
I think
so,
it's just general society though, because I think
yeah,
there's so much around, like I said, the media, you see everybody just having a baby. There's no
yeah,
story, because obviously people don't want to hear it, which I don't know why, but there is that reality. Like we said, the IVF doesn't work. Why isn't that on
yeah,
the news? Why isn't there a story about somebody who has had, the loss of a child? That happens. Why are we, it seems to be the other way. And this is why, people don't see that it's not happens, because like you said, it's perceived as a given. Oh, why don't you just do IVF? It's going to work. What's
yeah,
the big deal? Or why don't you go try surrogacy? It's going to work. Or why don't you go off and do the? It's that kind of a misconception that it's portrayed, I think, so much in reality. And I didn't know any of this. You're
yeah,
right, because wasn't part of it. But I think it's also, I think a lot of women have kept quiet about it for maybe decades and years of just kind of feeling that they couldn't talk about it because it was a stigma and people can't say it. And now, luckily, thankfully to you and other people who are talking about it, now it's becoming more apparent that this does exist.
yeah,
And I think that's where it needs to be changed in the reality that we're in. That we are also human.
yeah,
We have a heart. Just because we don't have a baby, it doesn't mean that we're less. We're just the same as you.
yeah,
We're still human beings, and I think that needs to be the same, that we're all treated in the same way as everybody else is.
yeah,
um, so yeah, hopefully at some point that will change for everybody.
yeah. Well, I think the more stories we share like this, like yourself, like thank you for coming on, but like the more stories that we share from loads of different perspectives, I think just the more aware people will hopefully become in general. And I think, like you said, educating kind of the general public is where we need to be at. So it's not just hushed and only the people who know, only people who know actually know, yeah. I think.
Yeah, there's a lot. I mean, people say stupid things when you have cancer. So, I
Yeah.
went all through that. And then I think people just don't know what to say or how to say. I think there's that lack of understanding. And you're right, education is the key. But there's also, sensitivity around how women get treated as well in the
Mm.
society. There's also the problem. And also the pedestal side of, oh, if you don't have a baby, there's something wrong with you.
Yeah.
You're not the same, you haven't met this standard, and now you're a failure as a woman. And I think that's the problem
Yeah.
that we've got to start that from the very first time a woman is created, that their focus isn't just about having a baby, because it doesn't happen. I never thought I was going to be sitting here doing this with you, and
No.
I'm sure you didn't either. We've just got here because of life. Life takes
Yeah.
you somewhere that you don't want to necessarily go to, and it happens to so many other people as
Yeah.
well. So I think that's where the focus needs to be changed, and luckily more people are talking about it, and that's why I
Yeah.
wanted to talk about it as well, because it needs to be spoken about, that this does happen,
Yeah.
and how difficult it is to deal with.
Yeah. I agree. You mentioned Jodie Day and Jessica Hepburn. Did they write one book together, or did they write two separate books? And do you want to talk to me about
Yeah,
the books?
sure. I mean, I was trying to find people who wrote, to give me kind of an idea, and thank God for them too. They wrote separate, so
Okay.
Jodie Day's written a couple of books,
Okay.
and Jessica Hepburn is the same. And that, thankfully for them, I kind of understood how to, and that's why I bought this as my two little hearts, which are to the embryos, because I didn't know what I was supposed to be doing. And it was a suggestion that buy something, do something, because I was trying to process it, and they were talking about their journey, and especially Jessica Hepburn, trying to find a way to live your life, I think, is what I'm trying to do. What is it that I can do now? What is it that my purpose is? Because I just felt so lost. What is it that you can do? And I think it's other people, like life beyond. There is a life beyond this. The same with cancer. That's why I volunteer with breast cancer now, is to say to people, look, there's a life. But the same with this, there is a life beyond not having a child. I think that's also
Yeah.
difficult for people to understand as well. They can't see that, and I couldn't see it, and I'm just trying to go through it. But there is a life that you have to kind of find, and like you say, there's enjoyment in little things in life. Traveling, may it be just doing whatever you want to do. I can do so many things I don't feel I would have been able to have done with a child as
Yeah.
well. So after, I sort of think about that. I mean, I'm later on in my life as well, so there's that aspect of, that's gone anyway. I don't need to worry about that, because I'm not in that stage where I'm seeing people necessarily get pregnant, because they've all done that
Yeah.
with the age that I'm in. So it's kind of like that period of my life is gone. I think they've given me, the books that I read gave me the kind of information and the knowledge that I needed to kind of think, thank God there's somebody else there that I can relate to. And I
Yeah.
think, I'm so grateful for them too. And also other women that have written books about this, because there is nothing else out there. You're trying to find something. And also Fertility UK has been amazing with their groups that I joined, with women talking about, them moving on from having this happen to them. There's a sense of belonging that you need to feel, as well as
Mm.
you're doing it. Otherwise, you don't know where else to go. You can't talk about it to other people, because they just don't understand, and they sort of look at you like, oh, and then just walk away. They don't want to know.
Yeah.
So yeah.
I'm glad that you mentioned Fertility UK, because you do some writing for them. So you said that you share monthly poems, and then you're also doing a writing session, like a workshop, I guess, for World Childless Week. Do you want to talk to me about your writing and how that started and what you write about and all of that?
Yeah, I've been writing for a long time, actually, since
Okay.
I was a teenager. And writing was really my healing tool for me, because it gave me a
Mm.
chance to express my emotions that I was trying to process into words. What does this all mean? What was I feeling? Because sometimes you can't talk about it. and you don't know how to articulate it and what it is that you're actually feeling, because it's such a different range of emotions, isn't there, with grief?
Yeah.
It's so different for everyone. And it helped me to process and get it out of my body, and it's so important to be able to release things. So it was just about, like you say, that the kind of issues about meeting other people, the stupid things that people say, do you have a child? Why don't you have a child? That kind of thing, of how it is, how I was, things I was engaging in, and what that meant for me in terms of processing all of this. And also letting out my emotions and how I was feeling about, like you say, it's multiple griefs. It's just, what's going to happen when I get old, all the things I'm going to miss on, being called a mum, having Mother's Day card, seeing my kids get married, all these things are multiple griefs. And also, what does that mean for my relationship with my husband? Because now, we're not going to have this child together. It's so much entwined in everything. Luckily enough, Fertility UK were kind enough to publish my poems, which they put monthly, which is the poems that I write just about that kind of subject. And I did facilitate another one for them previously on helping other women about writing as a tool to use, and I'm doing it again. So I'll send the advert to you once this has gone, and they have to join Fertility UK. But it's just, exercises where it's helpful, obviously, if you, have, obviously, because it's going to be upsetting if you kind of are a bit little removed from it slightly. But it's about, writing things about, your experience, again, what it's like, somebody says things to you, trying to get that emotion out of people, because sometimes, yes, you can talk about it, but I find writing such a therapy too for me. And it's still what I'm doing. It's still something that I find that I'm still expressing how I really feel about things. So it helps me so much, and I want to be able to hopefully help others as well. This is another group that I don't want to belong to. So first was cancer, now this. But it's about helping and giving back to others as well. So I hope I can do that for somebody else and give that a tool that they might be able to use, that they might be able to express their emotions and feelings around it. Because it has truly saved me in a way that I didn't think I was going to be able to have, for my own sense of how, how do you get this out of your body? How do you get out of this kind of pain? And it's still ongoing. It's, like we spoke about, grief is never ending, but it's just about helping you kind of express it as well in different ways.
Yeah. I think that's the good thing as well, is that, these different conversations, people heal in lots of different ways.
Yes.
And for you, it was writing. For me, it was maybe more yoga and meditation and more like spiritual things. For other people, maybe it's therapy, like it's talking, or other people, it's time in nature. And I think just kind of being exposed to different people's stories and what helped them and all these different things can help, the next women that are going to be going through this and experiencing this. It's amazing that you're spending time and energy and also kind of emotional energy, to write these things down, to share them with the world, because that takes a lot of bravery as well, to kind of put yourself out there, but then also to teach other women how they can use this tool for themselves and their own healing. I think that's beautiful.
Thank you. I mean, it just, like you said, there's so many other ways to heal. And it's like, there's no way that what you're supposed to be doing after this, And I think, luckily, as I said, Jessica Hepburn and Jodie Day talked about what they did, and it's finding out what is right for you. But there isn't a right way or wrong way. There is no way of healing through this or getting over it. It's just an everyday notion of trying your best and thinking, okay, what can I do tomorrow? And it's a way of just getting it out of me. Especially, you might meet somebody that says something irritating, then you want to just get rid of it, and you don't want to have it fester in you, because that always happens in society. And it's a way of expressing, and hopefully somebody else reads it and thinks, and also I did read my workout at an event, and somebody said, oh gosh, I didn't realize how difficult it was. And I think the more people talk about it, then it's education as well for others to hear about it. And also I've done it in rooms of women that I've spoken about children. I've said, I've had to expose myself, but I thought, you know what, I have to say something. And then they realize, and then they take a step back and think, hang on a minute, you're right. Not everybody has a child. And I think the more, you're also doing a fantastic job. This is the way to change things. Because if we don't talk about it, then how are people going to understand, and how are people going to take a step back and realize that they could be talking to somebody that has been through something so traumatic and horrendous and sad, and that they don't understand that it's best not to ask somebody, do you have a child? Just
Yeah.
don't ask them that. Ask them what they're doing for the day,
Yeah.
or something like that, or what did you eat for breakfast or something. But just not, why do you not have a child? I still don't understand that. And there's no need for that. And I think, again, it's about giving people hope. We all need to give each other hope to find something that you can kind of live your life beyond all of this.
Yeah, 100% agree. I have 4 questions that I ask people at the end of these episodes. So number 1 is, what do you want other women experiencing infant loss to know?
Oh gosh, what do I want them to know? I think the thing is, there's no right way, wrong way to grieve. I think, just go through whatever it is that you're going through. There is, if you're feeling whatever you're feeling, it's okay to feel that. Don't judge yourself. Don't think, oh, I should be doing it this way or that way. Just let yourself feel the pain. It's okay to cry. It's okay to scream. It's okay to do whatever it is that you're wanting to do. It's not perfectly normal, and allow yourself, if you can, to feel what you're feeling, because the better you get it out, then in, I particularly feel, because if you let it in, it festers and it kind of sits with you, and it kind of comes out a lot later. Yeah, and I think it's also maybe beneficial, maybe to see, if you can see a therapist, if
Yeah.
that's able, to somebody who's obviously knows about childlessness loss, and also, talk, join a group, like, as I said, Fertility UK, or if you're able to talk to others around it as well, because it can be very alienating and isolating, which is what I found, because I was like, who do I talk to this about? How
Yeah.
do I share this? And it was only through meeting other people. I thought, same with cancer, I thought, thank God people understand it and you get what I'm talking about, but other people don't. So
Yeah.
sometimes it's that as well, finding a place of belonging can help. But yes, it's, this is a dreadful place to be, but also just be kind to yourself, I think is important. Don't, try not to beat yourself up, because everybody else is doing it to you. So just try to be kind to yourself, do whatever you can to kind of help yourself through it, whether it's, yoga, like you say, meditation, going out in nature. Just understand that, these things are there to help you. And don't let everybody else tell you what to do. That's another thing.
Yeah.
Don't listen to people who tell you to Dr. Foster, because that's, if that's right for you, fair enough, and that isn't. But just take your time to find out what it is that you want to do, for yourself, and whether that's 10 years it takes you, or 5 years, or 2 years. That's your own journey. Just don't compare yourself to anybody else.
I love that. Thank you. Number 2, what do you wish society knew about infant loss?
This where do we have enough? No, do we have another hour? I think it's just that IVF doesn't work. I think
Yeah.
society needs to be aware of, that, this again, there's so much around it working, and also that we do feel, we do have emotion. Just because we don't have a baby, we're not less, we don't have it easy. I think that's another misconception, that just because you don't have a child, you're sort of carefree, going on holidays. That's because you have to fill your life up with something, otherwise
Yeah.
you go mad.
Yeah.
What else am I, what am I supposed to sit here do then, cry myself every day? You have to kind of figure out a way to live.
Yeah.
I think that's another thing. Yes, and also, grief is so complicated. This, I think just because, as I said, just with IVF particularly, because there isn't something that people can see, it's still the same thing. It's still the grief. And I think people just need to be mindful of that. with IVF, and especially with other people that have had a baby, is just be sensitive around what you're going to say to people and how that affects people. I think is very important. Yes, I think it's just all the other issues that we spoke about before as well, with work as well, with other situations, is, just to be mindful who's in the room and not think that everybody has had a baby.
Yeah.
Because there's people around you that haven't had a baby, and I think that's what is important to remember in life. And also everybody's journey is different with all this, that I'm sure you've spoken to so many people, that everybody's infant loss is not the same. And it's not the same journey. I got through IVF for having cancer. I wouldn't have never considered it if I hadn't had cancer. So it's just everybody's journey is different. Everybody comes across it in life, and it's not always a given. Because somebody said to me, "Oh, you could do it later on in life," but I wouldn't have been able to do it later on in life because I ended up having my womb removed. So there's not that sense of it happening. So I think it's important to remember all of those.
Yeah. The next one is, what helped and what didn't help with your healing journey?
What didn't help was I beat myself up a lot. I blamed myself. I felt like I was the one at fault for it, because I was the one with the womb. I also felt like I questioned a lot of my decisions. Should I have put both of them in? Was that a mistake? I felt like, especially with my womb, I felt that, oh, maybe I shouldn't have done it. Maybe my womb was just in a terrible state. I questioned a lot of my decision making. I asked a lot of doctors afterwards, did I do the right thing? Was it okay? I think that's what you do, kind of question. That's what I did anyway, which wasn't helpful because it had been done. And I think, you kind of live in that kind of past of should I not, blame myself. I felt also guilty in a way of taking it away from my partner, which just wasn't helpful. And also understanding that he was also grieving. I think I didn't even take that into consideration. I was so busy thinking about myself. I also called them my children, which was dreadful, I know. But I was like, oh, these are my children. I was like, hang on a minute, they're our children. I was just so much about my own issue, not even thinking about how it was affecting him and what that meant for him. And, because he was obviously feeling that. And I think that's also another thing that you have to be mindful of as well. And also just not not being so considerate about everybody else. Or somebody has a baby, oh, I must go and congratulate, let me go and sign their car, because I was not thinking about myself and what I was going through. I was just, oh, let me put the money in the car, let me go and sign, let me go, because I was just thinking about them and not myself. I think that's another issue. Yeah, that isn't helpful because I wasn't thinking about myself.
Like setting boundaries to protect yourself.
Yes,
Yeah.
but that comes later. That comes
Yeah.
a lot later. Initially, you're kind of like, you
What
don't
do
see
I do?
I didn't see the need to do it because I was like, what am I upset about? This is all happy. I'm just thinking about others. Now I've learned to have that.
Yeah.
But initially I didn't. Some people do initially. I'm good for them. But I didn't. I didn't think about that.
Yeah.
And yes, I think the helpful things that I found were reading the books that I did, thank God for them, researching, groups that I could join. And obviously that doesn't work for everybody. And then just finding, things that I want, finding myself again was the most important thing that I feel was important to do, was who am I now after not having a child? I think rediscovering myself, who am I again, what do I want to do? Small steps in terms of recovery, I think, is important, not trying to rush it. Oh, I have to get over it in a year, have to, this is it, it's done. I think that is also the key, taking your time, whatever time that is. I felt like writing, as I said, was really the savior for me. But also, like you said, yoga, mindfulness, crafting, I've got into whatever it is that you enjoy, whatever it is that you enjoyed before, kind of try to kind of go back to that again. Whatever you were doing before, whether it's running or whatever, walking or swimming, or finding yourself is an important thing to do. Because if you don't know who you are, then you're not going to be able to, find out where you want to go after all of this. Yeah, and also, making sure that you kind of regather your relationship with your partner is also important. You're not just parents, you're two people that are in love. So it's important to try to re-engage that relationship back with your other half, going out, dating, try to talk about it if you can with each other about what that meant for you, as well. And also, talking about your children, whether they're gone, we still talk about them, and it's helpful. We found that helpful because they're part of our life, and we still grieve through them, but it's about acknowledging that and then moving on for it. And I think you've got to share that together, that they're both where your life, but also you're both going forward with the next phase in your life as well.
Gosh, you have so much wisdom. I feel like everything you're saying, I'm like,
old I am. Thanks. I've done too much. That's why my life.
But it's so good even for me to hear all these things of I think finding out who you are again. I think that's really. I don't think anyone's said that before when I've asked this question, so I think that's a really great.
I think because I lost so much of myself, because I just didn't know. I just didn't know who am I now? Like you said, after not being able to have a child, because that's all I saw. Like you say, all I wanted to have was a child, and I still think even now I'm like, what do I do? Where do I go? How do it's that kind of motherness is such a huge part of yourself, being a woman. And I just lost myself, because I just didn't know who I was anymore after the children died. I was like, what do I do? Where do I go? I don't understand how to live my life. And I didn't see a life beyond having a child, to be honest. I didn't understand, what that meant for me personally. I was like, how do I go on from this? Because it was such an integral part of what I thought was going to happen. My marriage as well, my value was so important, in terms of having a child. It's that all goes. It's just in 1 minute. It's just broken in and ripped apart. And then you're sort of sit there, and I've had to work that out and rebuild myself, because I felt like I had been crushed by it, as well, by how it affected me in a mental and physical level as well. It's so raw. It's so much in yourself as well. So that's why I'm talking about it, because I've had to rediscover myself.
Yeah.
What does my life mean now that I don't have a child? What is important to me? Like, doing this was important. What do I want to do? Leaving a legacy just isn't about creating a life. It's not about that. It's just about, like, what you're doing, or helping people or making a difference in the world. Doesn't have to be just about having a baby.
Yeah. Gosh, thank you so much for that answer. Thank you for being so honest and open and raw and vulnerable with it all. I really appreciate it. The last question is, what advice do you have for partners or friends or family members to help you with your grief and loss?
I think it's just, I think partners, it's so difficult for them because they don't know what to do. I think also the other partner needs to understand that everybody, we all have a different way of grieving. Mark went off and did running, and I was like, that's not how you're supposed to grieve, or DIY, that's not how you're supposed to grieve. There is no way to grieve, because I was like, why are you not sitting there crying? I'm crying. You kind of assume that you're going to be both sitting there bawling your eyes out together, and there's going to be a profound thing, but you're not. You do it separately. And and then also, I was too much in my own thing. Not that there's anything wrong with that, but I didn't see what he was going through. And I think that's important to recognize within each other, and that there isn't a solution to any, because he was like, I want to try to fix it. I want to try to, and I think that's what people try to do intrinsically, because they don't want to see you suffer or have pain. I think around your families, I've been lucky that I've had that sense of understanding and love. But I think it's people just need to be sensitive around what they're saying, especially like we spoke about friends or other people. Oh, you could try to do this. There's kind of a fixing mechanism that people seem to always want to do. And I think that's not helpful. It's just allowing somebody just to say whatever they want to say without somebody saying, yes, but you can. We need that. We just need to be heard. That's it. Don't try to fix anything. There isn't a solution to any of this, as if somebody, having a foster or adoption child is going to fix it. It isn't, because at the end of the day, that's not your child. That is not something you've created. Yes, it's something that you look after. And of course, people who do adopt think of it as their child. But, you're not going to be able to give birth or have that end of something genetically being, your DNA, whatever you want to call it, but view it as. So I think it's other people just being sensitive around that end to what you're going through, and just being mindful about what they're saying. And I think if you can say to people, can you not, I just kept my distance when other people were getting pregnant. I just kind of explained it to them, look, I need time. Can you just, I need to have a bit of space. And they were kind of understanding around that. So I think, like you said about having your boundaries is so important.
Yeah.
It's not wrong if somebody, in your family is pregnant to say, look, I want to stay away, because it's not, you have to think about yourself, like you said, Christmas or whatever, it can be terrible. I didn't go to see my sister-in-law sometimes at Christmas after she had a baby, because I didn't feel like I could. And that was okay. She was understanding. And I think that's okay to do that, because if you don't, then people are thinking, oh, you're being a bit like, it's misconception around what the reason is. Obviously, she knew, but what I had gone through. But it's good to explain it as well. Then otherwise, you look like you're just being not happy. Obviously, I'm happy for them, and of course, but you don't want to come across like a bitter person, because that's another perception that you can come across as some bitter person because you don't have a baby. You're not bitter. You're just going through your own grieving process.
Yeah.
So I think there needs to be just a mindfulness about other people, and also just reach out to somebody, just say, how are you doing, if you are concerned about them, how's it going, can we do anything for you? That's all you need to say to somebody. You don't need to say anything else, or just, I'm here for you. I think that's another thing. And not to give solutions. No solution. We don't need, there isn't a solution to this, so don't try to give us one.
I think that's something I saw recently, was that grief just wants to be witnessed.
Yes.
And it's not that like you need to fix it, or like you said, I think they don't want to see you in pain, so they want to try and offer a solution. Oh, well, we can do this, do that. Well, actually, I just want you to sit with me and say, this is really shit.
Mm-hmm.
I'm really sorry
That's
this is
it.
happening. I'm here for you. And I think that is more than enough. That's exactly what you need to say and do, and just be there with the person and witness their grief and sit with them through the hard times and just be there. And like you say, it's not about fixing or solutions. And I think that's our like automatic thing. If someone's hurting, like, okay, what can I do to make it better? How can I take this pain away? It's a great thing they want to do. It's just not always helpful with that, because there's nothing you can do. Like, it's happened and it is what it is, and it's shit. And I just need you to acknowledge that this thing is really shit.
Yeah, if you can't say anything, don't say anything. I think, like you said, you just want to be heard. And you just want to be able to say, because as I said, it's disenfranchised, and I think you need to be able to speak it for it to be real, and for it to matter, and then it does matter. Anybody going through this, their pain matters, and I think it needs to be recognised and needs to be heard. and that's it. Just be there, and you don't need to say anything to that person. They will, and also need to say. I think the other thing is to say it to yourself as well. Is another helpful thing. I am going through something awful. If everybody else doesn't care, it's not about them, it's about yourself. That's another thing I would say is just say to yourself, oh my God, what I am going through is completely rubbish. I'm going through pain. I'm going through a terrible time. That's okay. That's not being self-absorbed. That's just what the truth is. And it's okay to say it to yourself because you're the one that's going through it. Nobody else is. And I said that to people when they were having cancer. It's to acknowledge what it is that you're going through because you're yourself, you're going through it yourself and nobody else can understand that.
Yeah.
Because you're the one that's experiencing it and you understand your own pain.
Yeah.
So yeah, that's another thing I would say.
I think, like you said, acknowledging the pain and acknowledging that it is really awful is helpful because it helps you, I don't know, kind of process it, I guess, and also give yourself compassion and understanding, like, this is awful. Like, I'm crying because it's awful, and it's okay that it's awful. It will be better one day, but at the moment, it's bad, and that's okay that it's bad. I think people try and, oh, it's not that bad, or oh, you'll get better soon, or oh, whatever the solution is that people try and come up with. It's okay to say this is shit, and I'm sad, I'm hurting, this is bad. I think it's okay to acknowledge that. I think sometimes we're scared to say those words because it seems too big and scary and dangerous almost. I don't know. There's kind of this kind of fear around admitting that something is really terrible.
I think because we're told to kind of get on with things and,
Yeah.
especially as a woman, get on with it, it's done, you're perceived as just being strong as a woman, you have to just kind of deal with it and move on. But it's okay to feel the emotion and to acknowledge it. Because if you don't, it kind of comes back anyway years later, or at some point it will be effective, and it's okay to sit with it and understand what it is that you're feeling within yourself, because you're like you said, you're going through the pain and you understand that pain. Nobody else can understand your pain because they're from the outside of it. They don't understand. You're experiencing it. So it's okay to say to yourself, oh, this is how I feel, whether it's anger, jealousy over somebody getting pregnant. That's okay because that's what you're feeling.
Yeah.
You can't ignore it because it's a valid emotion and it has to be expressed, and not to feel bad about it, because then why feel like that? Because that's how you're feeling.
It's all part of the process as well.
Yeah.
You
If
kind
you
of have
don't,
to go through
yeah,
all
if
the
you don't express
motions.
it, then it stays in.
Yeah.
And everybody else is just ignoring it, so you might as well just validate it for yourself, because everybody else kind of says, oh, go over there, get on with it. I mean, obviously everybody doesn't, but most people do. And I think that's the most important, is to be your self advocate and say, no, I am going through it. I am validating for yourself and say, no, go away. This is how I
Yeah.
feel. How would you know, kind of thing.
Yeah. Well, thank you so, so much for sharing your story and your thoughts and your kind of ideas and all these different things that you've shared. Thank you so much for being so honest and open and vulnerable. And it's helped me, and I'm sure it's going to help lots of people listening as well. So thank you so, so much.
I want to thank you for the opportunity, to be honest,
Yeah.
because this is such a amazing thing to be able to do. So thank you. Because the more voices are there, the better it is for everyone to hear people
Yeah.
talking about this from all angles. And hopefully this will help others. And I think we're all trying to help each other
Yeah.
in whatever way we can. And I think that's a beautiful way to live. And again, we're creating that legacy of, look, you don't have to have a child to create a legacy. And you're doing it, and I'm doing it. Everybody else who hasn't had a baby is doing it.
Yeah.
So there is a life to live beyond all of this.
Yeah. Well, thank you so, so much. Do you want people to contact you on Instagram or email or anything like that? Or are you...
Yeah, I don't mind. I mean, I don't put much on Instagram.
Okay.
I'm doing the world
Yeah.
childlessness,
We'll link to
and I will send you the poster once they publish it. And you have to go for Fertility UK if you want to join it.
that.
But I'm happy for people to contact me if they wish to share things that they understand, because I think the more people talk about it, the better it is. as
Yeah.
well. And I've got a blog as well. So if people want to join that blog, I do publish stories, or Fertility UK does publish my stories once a month. So if people want to read them, they're helpful too. But yeah, it's just been such a wonderful experience. So thank you for allowing me to be able to talk about it.
Yeah, thank you for coming on and for sharing your story. Thank you so
Thank
much.
you. Thank you so much.